It's time now for your Mowery Moment, brought to you by Mowery Clinic in Salina. Since 1934, Mowery Clinic has generously given back to the local community, sharing its time and resources with our area schools, charities, and businesses, proving time and again that you matter more at Mowery.
We're joined in studio today by Dr. David Battin, a cardiologist at Mowery Clinic here in Salina. Dr. Battin, welcome into the studio.
Thank you.
Now, you and your team of cardiologists at Mowery Clinic tackle a wide range of heart health issues, but one you face more often than you'd like is an abdominal aortic aneurysm, also known in the medical realm as AAA. Tell our listeners a little bit about AAA. How serious is this?
Well, it is a serious issue. The abdominal aortic aneurysm is a weakening of the arterial wall in the large artery that lies in the abdomen. It is responsible for supplying our organs and our legs and pelvic region. The weakening generally occurs somewhere below the kidney arteries, but it's largely asymptomatic. So unfortunately, by the time we discover the aneurysm, it's too late. A lot of these people don't make it even to the hospital for emergent surgery or repair.
Fortunately, Dr. Battin, you're one of the very few cardiologists that performs the AAA procedure. How can this procedure help those that are afflicted with AAA to prevent them from running out of time before it's too late?
Dr. Vernon and myself, he's a general surgeon at Mowery Clinic. We perform elective repair, usually via an endograft, which is basically a pipe that lines the inside of the aorta. And we try to exclude that aneurysm from the patient's systemic blood pressure by lining this area of weakening within the aorta. By doing so, the aneurysmal sac, which is the weakened artery, is no longer under pressure, and therefore the risk of it rupturing is mitigated. The endovascular repair, which can be done through small incisions or even small holes in the leg arteries, allows for a much quicker recuperative time and a much briefer hospital stay.
Dr. Battin, you and your team of physicians at Mowery Clinic really know their stuff. This is great information for our listeners. It could help save their lives. Now to something a little less critical. Physicians, hey, you're people too. You got to have a life outside of work. What do you like to do with yours?
Well, most of the time when I'm off the clock, vast majority of that time is spent with my kids and my family. I have 4 small boys, all 5 years of age or younger, so that doesn't allow for a lot of community stuff that doesn't involve them.
So that keeps you pretty busy.
It definitely keeps me busy, but we like to explore all things Salina in the area and really enjoy the small treasures that are in and around the city. I like to spend a lot of time outdoors. The family likes to spend a lot of time outdoors, hunting, fishing, etc. When we're not doing that, giving back to Salina generally at this point is monetarily, whether it's the Salina Mission or any of the local Boy Scouts or Girl Scouts that come knocking on our door. We're happy to help.
Dr. Battin, we really appreciate you being a part of the Salina community and what you and the team of cardiologists are able to do at Mowery Clinic. You're saving lives, and we can't thank you enough.
Well, thank you very much for having me and putting up with the 3 cancellations to allow us to get to this point here today.
Hey, if there's anybody whose schedule is a little bit crazy and hectic, I know it's the life of a doctor. So thank you very much.
Thank you.
This has been your Mowery Moment, brought to you by Mowery Clinic in Salina. To learn about all of the services Mowery Clinic provides, go online to moweryclinic.com or give them a call at 800-223-0845. For medical care, you matter more at Mowery.